Now moving on to the next virus, which is the varicella zoster virus. This varicella zoster virus, it is a double-stranded DNA virus. So usually most of them will acquire the infection in childhood and it will remain dormant. And 90% of the adults have serological evidence of immunity. The varicella infection declines by 95% after the introduction of varicella vaccination. So even now, vaccines, even though it is available, it is not being actively taken from the humans. This is because the awareness to the varicella vaccine is very, very less. So it is a high time that all the doctors, the clinicians advise the importance of varicella vaccination. And if you find any individuals who have not got chickenpox, they can take this varicella vaccination, which is safe. And because infection which occurs in the adulthood, if they get the infection in the adulthood, it can be very dangerous. So the importance of varicella vaccination has to be stressed. So varicella infection, after the introduction of vaccines, it has reduced to around 95%. So now the laboratory diagnosis, the infection is mainly, you can do a polymerase chain reaction of the vesicular fluid. So the active lesions, when they are present, you can take the swab and you can do a polymerase chain reaction. Congenital varicella, you can diagnose by doing a PCR amniocentesis on the amniotic fluid. This direct fluorescence antibody testing, the sensitivity is very, very low. It is not done. And something which is called as a Zank smear. This Zank smear has a rapid turnover time, but again the sensitivity is very, very low. So what is a Zank smear is that, how will you take a Zank smear is that when you have any lesion or when there's a crust or something, we will take a glass slide and we'll take it from the lesion. Usually we should take the specimen from the base of the lesion. So we will remove the crust and using the slide we will take the specimen and we will look for this something which is called as the multinucleated Jaynes cells. These multinucleated Jaynes cell, it is an evidence of or a hallmark for this herpetic infections. So they show multinucleated Jaynes cells. So what does multinucleated Jaynes cells means? Nothing but it is a cluster of cells. So monocytes, there might be a cluster of monocytes or a cluster of macrophages which is called as the multinucleated Jaynes cells. So now moving on to the next virus, influenza virus. The influenza virus belongs to the Orthomyxidae family and it is an RNA type of virus. The symptoms, it's usually fever, dry cough and systemic symptoms. It can be it can cause serious infections to the pregnant women. However, in a non-pregnant population, this cannot be so much severe. But in case of a pregnant population, this can be very, very dangerous. So how will you diagnose? We will take the nasopharyngeal swab and we will test. So there are kits which are available which is called as a rapid influenza diagnostic test. So the swab is taken and this is one type of kit where they will place the swab here and they will look for the test. Commercially available multiple molecular assays are available and they also help in differentiating between the influenza and the SARS-CoV respiratory virus. So it's generally the swab is taken from the nasopharynx. So nasopharyngeal swab will be taken and we will send it for the rapid molecular or viral antigen detection, that is called as the rapid influenza diagnostic test. So these are the kits. The mumps virus, this is an RNA paramyxovirus that primarily infects the salivary glands, but it may also involve the gonads, the meninges, the pancreas and the other organs. It is transmitted from direct contact with respiratory secretions, saliva and fomites. Most transmission occurs before and within 5 days. So after within 5 days of parotitis, within the onset of parotitis, within 5 days the transmission is high. And the droplet isolation is also can be recommended at this time. So the laboratory diagnosis for this will be, the diagnosis of acute infection can be made by the IgM antibodies in serum, the serology. Additionally, you can also do an RT-PCR by using a throat swab or the nasopharyngeal swab or even urine specimen. So all these the virus is present, so we can take the swabs and we can do an RT-PCR, or you can also do a serology to find out whether it is an active or primary infection or a latent infection.